agenda is Dr. Tyler Reimschisel, who is the founding director. A little bit of this information was on the agenda. Founding Associate Provost for Interprofessional and Interdisciplinary Education and Research at Case Western Reserve University. In this role, he coordinates interprofessional and interdisciplinary education and collaborative practice initiatives for graduate and undergraduate students, faculty, and staff. Dr. Reimschisel is board certified in neurology with special qualifications in child neurology, clinical biochemical genetics, and clinical genetics. Tyler has been described as a transformational leader and has made important contributions in future leaders in the field of neurodevelopmental disabilities. I'm quoting now from the citation, I think, that was given when Tyler left his previous position to move to Case Western. His contributions in teaching, mentoring, curriculum development, leadership and education, and service to the field have been described as exceptional. So we are very fortunate in having a transformational leader who has made exceptional contributions to the field. And I'm going to turn it over to Tyler so that we can hear his presentation. And Amelia is going to share her screen so that, Tyler, you can do your presentation. Thank you for being here.
Well, thank you, Suzanne. That was a great introduction and very kind of you. Suzanne and maybe others did ask me to send some information, sort of bio. That part about transformational leadership, I did not share. So that must have come from. That's kind of why I had that face like, whoa, that was very kind. So I am going to tell you about what we're doing here at Case Western Reserve since mostly since I got here in 2019, but the university has been very involved in interprofessional education for over a decade, and I have a slide that sort of summarizes that. So I really feel like I'm building on a lot of work that's already been done at the university and with the health programs here in Cleveland, and kind of build on that. So if you go to the next slide, I'm going to start with a bit of a thought experiment. So I want you all to imagine that we are part of an orchestra. And I don't know if you're familiar with the Cleveland Orchestra, but it's internationally recognized orchestra. And so we all get to be on the Cleveland Orchestra.
I do want to say I like classical music, and I'm a self-advocate with a disability. I grew up liking it.
That's good. I love classical music too, and that's why I use this analogy. Okay, so we're all of us here are going to be in the symphony, and Severance Hall is what's listed there, or not listed, what's pictured there. And that's inside. And so there we are. We're so far out, we can't see each other, but we're in there. And so I want to know what each of you would be playing. What is your, so if you could just unmute yourself and just pick an instrument from the orchestra that you would play if you could be in the orchestra. Or you can put it in percussion. That's good. You can put it in the chat too. Trumpet, violin, that's good. We have to have a violin player. So we got a couple of percussionists. Good, I played the trombone. Okay, so we have a piano player. French horn, so that's good. So we have some brass, another violin player. Okay, that's excellent. Thank you. Flute. So imagine that you have worked on your, now you're a professional in this mind challenge here. You are a professional musician, so you've worked on your pieces, your part of the pieces, and you've practiced with your section. So the violins have practiced and the French horn section has practiced, and we're all ready now to come together as a full orchestra to bring it all together. And the very first time that we do that, where we play these pieces together as a full orchestra and not just our section, is, and if you go to the next slide, you will see, it's the night of the performance. There's the audience. So we get to finally come together and play on the night of the performance. Now, because we're part of the Cleveland Orchestra, we're probably pretty darn good at playing, and we might be able to pull that off. But most orchestras could not do that, and that would not be really appropriate. And I would say that you might get through your part, but we wouldn't really be playing music together, right? We would not be playing in the sense where I have to step forward when I have the melody, my section has the melody, and step back and really play music and not just play notes. And I would argue that a lot of what we do in healthcare is very similar to that analogy. The first time that we have people come together to provide care to patients and families is when they're providing care to real patients and real families. And we might pull it off, but if we're a young professional, if we haven't had a lot of experience, it's probably not ideal. And so what we're trying to do is to help students and faculty practice before they're actually providing care in the most authentic setting. The other thing I'll just point out is that audience there may not feel like they got their money's worth if we actually did that, but there's no safety issues involved. When we don't practice well as an interprofessional team, patient safety is at risk. And so it's very high stakes. And so if you go to the next slide, I want to highlight this issue about patient safety. So the Institute of Medicine, you may be familiar with this, and these first few slides may be a bit of review, but I decided to leave them in because I want to set the frame to understand why we're doing what we're doing at Case Western Reserve.
No, we don't know if it'll
The
work.
first part is that in 2000, they emphasized through the publication To Err Is Human that patient safety was a major problem. And then if you go to the next slide, and I think it was the following year, they said to improve that, we should focus on these 6 aims. Our care should be patient-centered, timely, equitable, efficient, effective, and safe. And then 2 years later, they gave some ideas, if you go to the next slide, of how to do this. And so the HPE stands for Health Professions Education. And they were saying that as we're training students or young healthcare professionals, or as we're providing continuing education, we should make sure that we are patient and family-centered, that our practice is evidence-based, that we're utilizing informatics, that we have a sense of continuous quality improvement, and then we focus on teamwork. And I highlighted the teamwork in red, not because they highlighted it, but it was one of the top 5. But that's what I'm going to focus on, is teaching about teamwork. And so if you go to the next slide, this is how we define teams for all of the courses that we offer, or all of the interactions that we have with learners. So we want them to recognize that teams are 2 or more people who interact dynamically, interdependently, and adaptively toward a common and valued goal. They have specific roles and functions and have time-limited membership. So we really want to emphasize this interdependence and that you're adapting to the situation. And so we try to create experiences where the teams have to adapt and have to think together creatively about how to achieve their goals. So all this will become relevant when I tell you about the interprofessional course that we have. But you can go to the next slide.
Do you even teach us in human services? Because this would be great, you know, the county and the bigger picture, like in Minnesota, because this project needs to be out there in all angles, not just in the doctor's office or a medical field.
Yeah, it's a good point. We haven't done that yet, but we're new. So hopefully as we are able to scale this, something we could certainly think about doing. You can go through this slide, just skip this slide. And if you go to the next one. So we probably are very familiar with the interprofessional education definition, but I want to focus on the part that's underlined, that we're learning together to enable effective collaboration and improve health outcomes. So it's very goal-oriented. It should not be just what's done in a classroom, but also it has a clear deliverable, a clear outcome where we are collaborating better and we are improving health outcomes. And that could be for individuals, but it could also be for communities or populations. And then just click a couple of times to go through this slide. We can skip the next part. And then if you'll go to this slide. So it is required. All of the health professions and social work programs are required. I used the example here of the medical school, but I could have done this for any profession, as you know. So interprofessional education is a requirement, and it's now part of for the medical track, it's also part of resident and fellowship expectations. So if you click again, you'll see that they use the term teaming. I think that comes from Amy Edmondson's work. So if you go to the next slide, you'll see a little bit more about that. And so Amy Edmondson uses this concept of teaming, but it's this idea where we are learning how to work in teams across different disciplines. So if you'll click a couple more times, go ahead and click once more. So I said earlier, there's a history at this university about doing interprofessional education, and this just lists a few of those. I'm not going to go through each of these in turn, but I do want to acknowledge that what we're doing now is built off of several years of growth and learning among the faculty about how to do interprofessional education. And so you'll see there in the last column that the Associate Provost for Interprofessional Education that's the position I have. And so they posted that position in early 2019. And I came at the end of 2019. And so if you go to the next slide, they established this office. Initially, it was an office that was going to be just over healthcare, but our provost said, you know what, it's not just health professions who need to know, health professionals who need to know how to work in teams. Everyone really needs to learn how to work in teams. So he took the position, moved it into University Central, and I report to the provost. And I'm not gonna be able to talk about this much, but we are starting to work with non-health profession schools like the law school, engineering, our School of Management, and undergraduates even, to help them learn teamwork skills. So our goal is that we would help everyone have higher impact through effective teamwork. You go to the next slide, you'll see that this is part of our strategic plan. So the pathways are listed on the right-hand side, and pathway 1 for our strategic plan is igniting interdisciplinarity. Part of that is interprofessional practice, interprofessional education. So this has been embedded into the strategic plan of our university. And I think that that's crucial to have that leadership at the highest levels. If you go to the next slide, you'll see the various groups that we work with at all of the different schools and the college are listed on the left. And then we have a lot of partnerships with hospitals and medical centers in Cleveland, as well as community organizations. So what do we do? If you'll go to the next slide, this sort of outlines, I'm sorry, one more thing. We have a building. That's kind of an important part. I should probably not forget that. This is the picture of the atrium of the Samson Pavilion in our health education campus. So this building houses under one roof our nursing school, medical school, and affiliated programs, and the dental medicine program. So the atrium, which is what you're seeing in the picture, is a central area where there is a UTech, University Technology Support, cafeteria, study area. My office is on the first floor. That area that's pictured there is the size of a football field. So it's literally 100 yards big. So this is a very large building. And in the building are rooms that are designed for teamwork. So we have 2 rooms that hold about 220 students or learners at tables. So this is where we do a lot of the classroom work. So most of what happens in this building is not interprofessional, but a lot of what we do is interprofessional, and many of these students are already co-located, so they can go to the room in their building. Some of the schools that are involved in our interprofessional work are in other buildings on campus, and we have shuttle service that brings them here. But the point is we have a physical place to bring all the students together, and that is a huge asset. Having said that, when we did a lot of our IPE training last year, it was all by Zoom. We were actually not in this building at all. And so I don't think it's absolutely essential to have this space, but it does enable us to have this common space. The other thing I think is it says a lot about this institution and our partnership with Cleveland Clinic, because this sits on Cleveland Clinic property, to have this space and to have that forethought of having the ability to bring the students together in large rooms designed for teamwork. So if you go to the next slide, this is sort of a list. I'm not going to go through all of this, but just to give you a sense that on the left-hand side, you'll see the undergraduate work that we're doing. The BME is biomedical engineering. There's some things we're doing with the graduate students, and then practicing teams. We're working on developing faculty development for practicing teams in hospitals. I was coaching a team this morning of division directors at university hospitals for 2 hours. And so we do a lot of team training and coaching for practicing teams in a clinical setting or it doesn't have to be clinical, it could be a nonprofit. And then the middle part at the bottom is non-curricular. So we have a newsletter that shares information about interprofessional education opportunities across the different schools. We have a student governance committee that has representation from the different schools and programs. And we're trying to have more social events where people can come together and get out of their corner of the building or get out of their silos and get to meet each other. It's been really hard in the pandemic because we didn't really want to do a lot by Zoom. People were getting tired of Zoom. So I don't have time to go through all this, but what I do want to I think the main reason I was asked to talk was about collaborative practice 1. So if you look at the second rectangle in, collaborative practice 1 is the first thing that's listed. And I'm really going to spend most of the time talking about that because that is our largest program and it's the one that we have learned the most from, I would say. So if you go to the next slide, I'll explain this. So this is just going to be building a slide. But what I'll start with is that we have our interprofessional class on Wednesdays from 3 to 5. This year it was September 8th through April 20th. And it's for all of the students in those professions that are listed there who are first years. The only non-first year students we had where we had about 110 fourth year BSN students. So they're undergrad students, but they're in their last year. And this is a mandatory course for all of the students every Wednesday from 3 to 5. It is a huge time commitment. But that is something that the deans and the president committed to doing about 2 years before I came. And so what I'm going to describe is what we do on those Wednesday afternoons, and that's in the diagram below. So they are doing a community-based project as a team while also learning about teamwork skills in the classroom. So that circle, half of it is the project and the top half, and the bottom half is the classroom. And the reason we did it that way is that half of the Wednesdays they're working on the project and half of the Wednesdays they're working in the classroom on classroom content. And in both settings, whether they're working on a project or they're in the classroom, they're learning interprofessional service learning, and they're learning about how to work in a team that has diverse backgrounds. And so if you click, you'll see that I'm going to talk a little bit about the community-based projects. So the projects themselves are developed by the organizations we work with. They create projects that are authentic and meaningful for them and the clients they serve. And it has to be focused on health and well-being very broadly. And I'll show you examples of those projects in a moment. We tell the students that it's going to be about 1 to 2 hours of work outside of the class time per month, but most of the time they're working on the project is actually on Wednesdays from 3 to 5. So while they're doing this, they get to apply their teamwork skills, but they also are out in the community, or at least on Zoom with community members, because a lot of it's been done by Zoom. So they get into proximity with people in the community. This could be people with disabilities, for example. But it could also be people who are immigrants. It could be people who have been historically disadvantaged. It could be a variety of different individuals. But the point is that they are engaging with they're engaging with clients or individuals who are different than them in many cases. And so this is an important aspect of this, where they can learn cultural humility and service to others, which is a core point of professional identity formation. Then if you click again, you'll see that each organization has a champion. So this is a employee of the nonprofit organization who is the liaison between the organization and our office. And they really are the ones who are helping to guide the project. They kind of serve like a client for a project, but we also use the analogy, they're a bit like a patient in a clinical setting. They're the most important member of the team, but they're not actually going to do the work of the project. They're going to help guide it. And then if you click again, we provide team coaching for this. So the teams are given a project without a lot of direction. And this is asking a lot of the students. So we say to them, your team has to lead the development of this project. If you need help, we will guide you, we will help you, we'll coach you, but we're not going to do it for you. And we're not going to tell you exactly what to do. And I will tell you that for some students, they rise to the occasion and they do great things. For other students, this is a huge ask and they really struggle. And so we want them to recognize that the locus of control is within the team, and they're responsible for doing this project. Because they're meaningful projects, it's a significant ask, I think. They meet with a coach, they meet with somebody twice in the year, and then we do formal team coaching for 2 hours, like midpoint. It's usually done in January. And we will meet with them more if they ask. And then let's talk about the classroom session. So if you go, yeah, thanks. So there are topics around service learning and teamwork content. I'll show you what that is in a minute. We use a team-based learning format, which is a flipped classroom approach. There are assigned readings, assigned work to do, and then they come to class, take a quiz, work as a team on that quiz, and then apply it in cases. And this requires a few hours of preparation time. And if you click again, we had about 45 instructors. So everything is done in teams. So we have a team of instructors that's also interprofessional that work in teams to provide the class. Logistically, just so you know, without getting into too many details, unless you want to ask questions about that when we have questions, we have 93 teams, and to get this all done, basically every class has to be done 4 times. So those classroom instructors are teaching the same class 4 successive weeks, basically, just to rotate all of the teams through each session. So half of the students each Wednesday are doing the projects, half of them in the classroom. And then for the classroom sessions, we have 2 different classes going on simultaneously. And the next week, those classes will flip. And then those 2 sections will go back out to the community partners, and the community, the teams in the community will come into the classroom. So it's a lot of logistics. You go to the next slide, you'll see, oh, and then they have a showcase, sorry. We did this where all of the teams came into our building, and the champions came from the organization. There were about 100 of them, because some projects have more than one champion, and they presented their deliverable. The champion got to talk about what it was like to work with the teams. They fielded questions, and we gave them feedback on their assessment. I mean, we gave them feedback on their presentation. So that was a showcase. And then we had a reception at the end. The students loved the food, but we had about 600 people here. It was pretty exciting to pull that all together. The first year we did it, we did not have a showcase. We had a showcase, but we did not have a reception because we were in the midst of the pandemic. So it was nice to have everybody in the building wearing masks, but at least we were together. Okay, I think in the interest of time, let's go through, let's just skip these slides. I had a little bit about, just you can click through these about how what kind of the focus on teamwork. And as you're going through, you just get a sense, we really focus the content around teams and not just about the roles and responsibilities of each profession, but really about teamwork. And you can go to the next slide. Yeah, click through this one as well. This is what I wanted to just, so you can read through this and I'll pause and let you can get a sense of the content of what we teach. We organize our curriculum into 3 main buckets. Self and team is the second one, and then system. And these are the 3 levels we talk about that makes for an effective team. I need to have awareness of myself and what I bring to the team. I need to know about teamwork skills, and then I need to know about how our team sits within a system, whether that's at an organization or in a health system. And so this is how we organize the content of our curriculum. And you get a sense of the different topics that we teach. We do a lot of team steps teaching, but then a variety of other topics as well. So you can go to the next slide. This is some examples of the projects. They fall into broad categories like health education, creating health materials for clients, doing needs assessments for the organization, and then doing helping with mental health services. I'm going to give one example from a needs assessment because this is sort of an interesting, I think this is a good example of the combination of doing a project and learning teamwork skills that applies to your future career. So we had one project this year where the students created a survey and then administered the survey to a group of seniors at a center here in Cleveland. And it was basically around what could the organization do to improve the seniors' access to health and health awareness and knowledge. And then based on that survey, the students developed a tips sheet or tools that explain things like, how do you access your electronic medical record? And we have 3 major health systems here, so they had to do 3 different examples. How do you call for transportation to go to a clinic? How do you apply for various services in the city and what services are available? What websites are available? So this was based, the content of the information was based on the survey. So that's very practical and very helpful. Here's the funny thing. A few of the students in that team said, this is not relevant to our future career. Why are we doing this? And besides, when we have to do these surveys and we start asking these questions, the person we're interviewing, they go off on a tangent and it takes forever to do these surveys. And so what's funny is that to the faculty, you're like, yes, this is completely relevant to your life as a future healthcare professional, because you are going to be interviewing patients and clients, and you are going to need to manage the time of getting the information you need while building relationship with the person you're interviewing. And how do you manage that? And how do you ask questions to get at what you want? And then how do you provide what you're being asked, right? Or what you were finding. So we did not do a very good job, I guess, of explaining the relevance of the project. But a lot of times students don't see that the skills we're teaching them, even if they don't involve patients in the traditional sense, are highly transferable to their future career. And that's really what we want to do. And so it was an opportunity for us to say, well, here are all of the reasons that you're doing this and why it is relevant. Right, so these are first year.
And you need to go back to them, this is Heidi, really quickly, and say to them, because I live it every day, that it affects my transportation and it affects my human services. So it's very important that they learn what you're teaching right now as you speak, because I can't do some of this. And also they need mental health, they need everything from A to Z that you're talking about right now. So I'm glad you're pointing that out very clearly, because I can't do some of this without a professional diagnosing me or making a weird point to the fact that I have a real disability. So I'm glad you're doing that, because I deal with this every day, teaching them how to do it, and they're clueless, some of them.
Yeah, that's right, Heidi. So I think that they feel like a lot of these things are not science. They're not anatomy and physiology and diagnosis, but it's what health professionals do. And so, you know, we need to do a better job explaining that to them. And I think that also we're hoping that they will trust us, that those of us who practice know what they need to learn, and it is relevant. So if you go to the next slide, and then I'll almost be done. I want to talk a little bit, because I assume there were some educators here. I want to talk a little bit about the assessment. So what you're seeing is peer assessment and self-assessment. So twice during this time period, at the end of each semester, we asked them to assess each other and themselves on 4 dimensions. And you see those numbered in the middle of the slide. The task of doing the project, non-task things. This is stuff, and we explain what this is. These are things like active listening, valuing individuality, being a cohesive team, showing solidarity. Those are non-task things. Power and influence is how we ask them to share leadership from one week to the next, and how well are they leading a team? How well do they give people a voice on their team? And then openness is similar to psychological safety. It's basically, can I bring up issues that I know are not going to be popular and know that my team will listen to me and welcome that, even if they feel frustrated that I keep bringing it up. So this ability to share concerns and not experience retaliation. And so each colored bar for each of those is a student giving me feedback. Let's say that this is an assessment of me as a student. Each color bar is the student in my team giving me feedback. And then the bottom graph is comparing my data to other students in my team. That's the green bar. So the blue bar is my average. So it's 4 on a task, a little over 3 for non-task. And then the green bar is my team, all of my team members. How do I do compared to my team? And the yellow bar is all of the students in the course. And then the black dotted line is how I viewed myself. And this is very telling to the students because it helps them see how they are seen by their peers. And this actually, this year we know, was one of the most highly ranked aspects of this course because it allowed the students to give each other feedback and then they could hear about it. And then we asked them to take this data and do an individual action plan. What do you want to change about how you come to your team over the next semester? And then we do this again at the end of the second semester. So we have a lot of data of change from time 1 to time 2 based on peer assessment. So that is assessment at the individual level, but we also want to assess the team. So if you go to the next slide, we also are assessing the team. And so this is an example of an individual team assessing how well they think they're performing, how satisfied they are, and how much psychological safety they have in the team. So that are sort of standard team assessments. But if you click again, you'll see that we do this much larger team assessment that has 10 different aspects. And what it's saying is in this spider diagram, the 10 different aspects, so engagement, active listening, individuality, are the different components of teamwork. And we explain this to them, we teach them what these mean. And then they rate their team on where they think the team is now, that's the blue line, and where they think their team could be, which is the red line. And if you see that gap, like if you look at active listening, there's a gap between the blue dot, which is a little bit below 4, and the red dot, which is a little bit below 5. So what they're saying is on average, they think they could do better on active listening and go from a little below a 4 to a 5. So click again, if you go forward one slide, this then shows that data by student. So this is the actual, where do we think we are now? And the desired, where could we be with some effort for each student. So each line is a different color and it represents a different student on the team. And we coach to this. So this is data that this is what I did this morning. It takes a couple hours to go through this. So obviously can't go through it all today, but what I want to show you is that there's different perspectives from the team. And this is very educational for the students because I had one student say, we all think we're a great team. We all think that. And I'll be like, really? What does this data show? So they have this perception that their view of the team is shared by everyone. But in that case, there were members of the team who didn't feel there was psychological safety, who didn't think they were doing as well. And that opens up this opportunity to say, why is it you don't know that there's this difference of opinion and what can you do to work better as a team? So these data are very powerful. And so they fill this out. We do a 2-hour coaching. The way we do it is we have a coach who goes back and forth between 2 rooms for 2 hours and coaches the team to work through this data. And at the end of this, they come up with action steps that they want to take as a team to improve their teamwork going forward in the second semester. And then we do this again at the end of the experience. So again, we have now data, not just from a pure individual level, but at a team level. And then if you go forward, click forward once more, you'll see we also get feedback from the client about how they think they're doing. And all this comes with qualitative data that I can't show you, but we also ask the champion at the organization, how do you think the team is doing? And this is very helpful for a lot of the teams because many times the students will say, we think we're doing great. And then they hear from the champion and be like, well, they're not so happy with what you're doing. So it's very helpful for the students to say that a good team is not just about how we're doing internally, but it's also about the deliverable, the outcome, or the performance we're providing. And so this has been very helpful. And there's all kinds of permutations of this because, you know, some teams have insight to this, some don't. Some are very welcoming of this information, some are resistant. So that's what we do during the coaching, is to work through all of that. So if you go to the next slide, yeah, I think I'm going to close there and just ask questions. But can you click through a few more slides because we don't have time to do this. We're developing a certificate program, so you can keep clicking. That's not course related. And I think the next slide is about, we're going to do a clinically based team project starting this fall and hopefully expanding that out. So you can click again. So this would be for advanced students. where they're working in teams on a clinic-based project instead of a community-based project, and applying those skills in a clinical setting. And then if you click again, I think it's about my coaching. I just do a variety of team coaching for established teams. And then I want to, if you click once more, you'll see that it's a huge team. We have people from a variety of professions and support from our deans and our provost. So you can stop sharing at this point. And I think